Okay, so I have case one, and she likely has nociplastic pain because her TKA was 6 months ago. She likely had acute pain at the time of her surgery because there was actual tissue damage at the time, but now that we're 6 months out from surgery, there's no potential or actual tissue damage. So at this point, and with this time frame, she likely has nociplastic pain. Okay, Kevin, so I've noticed during our sessions you've had mentioned some thoughts that I've taken the time to write down, and I thought we could discuss them together because I know you were mentioning that your last PT experience wasn't the best, but I'd like to make that a little bit better, and I'm sorry that you did have that experience, but I think maybe going through some of these thoughts can maybe change your PT experience this time.
Yeah, I'm really worried you're going to hurt me and I'm going to have to stop coming to PT again.
Yeah, and that's really understandable that since you said you were having some pain with your last PT experience, that makes it much less enjoyable. But I think what we could work on is maybe flipping that into a more positive thought so that we can have a more positive experience together. Do you have any thoughts of how you could make that more positive, if you'd be willing to try that?
Yeah, maybe something like, I know my last experience with PT wasn't what I expected, but I know this one can be better.
Yeah, that sounds great, and I think that's a great way to flip it into something more positive. And I'd like to work with you too on making this better because that can help your pain, and no one wants to do anything that they don't enjoy. So I think we can work together on that. Another one that I saw or heard you say and wrote down was that you were worried about COVID just because it's so new, and you were worried about that maybe infecting your scar.
Mm-hmm. Yeah, I wasn't sure how long it would take my scar to heal.
Okay. Yeah, and I know after looking at it a little bit, it looks like it's healed really well. The incision looks like it's fully closed. It doesn't look like it's infected at all. But I would be willing to wear a mask, wear gloves, whatever you feel like you need to make yourself feel the most comfortable.
Yeah, that makes me feel a little bit better.
Yeah. And I can keep an eye on the scar too to make sure it's not getting worse. But after talking a little bit about that, is there a way you feel like you could make that thought into maybe a little bit more positive one?
Yeah. Maybe something like, because my surgical site is fully healed, I know there's a low chance that touching my incision will give me an infection.
Yeah, that sounds awesome. Yeah, and like I said, I can do whatever you feel like you need to have it be a comfortable setting for you. But I think also as more research about COVID is coming out, we know that usually it doesn't spread that way. So I don't think you're necessarily at risk for getting infected because you have a scar. Like I said, it looks like it's healed really well. And that kind of leads into the next thought that I wrote down. And this one's a little bit different because it didn't come from you. It was something that you heard. But I know you mentioned your son looked at your scar and said it looked maybe kind of like it wasn't healed well, maybe that it was still infected. Is that right?
Yeah, he made a comment and it made me feel really bad about my knee. And that's something that I was worried about even before getting the surgery.
Yeah, and that's understandable too because it's coming from someone that you care about and you probably value his opinion. But I think, as we kind of talked about previously, your knee looks really like it's healed really well, and the incision doesn't look like it's infected. So I understand that you're valuing his opinion, but I also think we could maybe take a little bit of time to talk about like what does a knee look like that is infected, and I've taken some classes on that, so I've been kind of trained to know if something's infected or not because I know that can affect your healing process. If you're interested in talking about that to make you feel a little bit better.
Yeah, I would like to talk about that a little bit.
Okay. And I was going to ask if your son, if he has any experience with wounds or scars or anything like that.
No, he's never really seen any scars before, so
Okay.
He doesn't know a ton, but I still value his opinion.
Yeah, I get that. So I think we can take a little bit of time to talk about that, and then that's something you could relay to your son too. So a few common things that we look for when we're looking for an infection is if you have a fever, if there's like excessive redness around the scar, if it feels really warm to the touch, if there's any like anything like coming out of the scar that looks abnormal. Those are some of the key things we'll look for infection, and as far as I know and what I can see, it doesn't look like you have any of those things. So I think maybe you can take some of that information and give yourself peace of mind, and also you can educate your son on that too, so you can be a little bit more on the same page.
Yeah, that makes me feel a lot better.
Great. So Kevin, after talking through some of those thoughts and making them a little bit more positive, I think there's a way we can kind of try to make this more of a tangible idea, or just like a tracking mechanism to keep yourself on track and kind of hold yourself accountable for those thoughts. So what I'm going to have you do, I'll let you take these home with you. Put some rubber bands on your wrist, and you can do this for sure when you're here, but I'd like you to try it at home too. Every time you notice yourself either thinking, saying, or hearing one of those thoughts that maybe aren't so positive, I'm going to have you move one rubber band over to the other wrist, and that'll just be a way to tangibly see when you have one of those thoughts. So if you're willing, would you like to try this with me today in the clinic?
Yeah, that would be great. I love having something tangible to remind myself.
Great. Okay, so I'll give you these. Put those on your wrist, and I'll just let you wear those throughout our session today, and then if you need them, they're there.
Cool. This is so hard. I don't know if I can do this. Oh, that wasn't very positive.
Nice catch. What's something we could say maybe instead of that?
Maybe something like, even though this is hard, I know that I'm capable of doing this, and it's going to help me to be able to walk around the grocery store.
Nice. That's awesome. One other thing I think you could do is, if you feel like you're forgetting to use the rubber bands, maybe get your husband involved and keep holding yourself accountable, but you did a really great job catching yourself with that one.
Thanks. I'm willing to work on this because I want to get back to my normal life.
Awesome. Okay, Kevin, so I'd like to show you one more way to kind of manage the pain you've been experiencing, and it's called the cup theory. As you can see, I have a cup and some pieces of paper, so I'll kind of explain the purpose of it and how we'll do it, but would you be willing to try that in clinic with me today?
Yeah, I do feel like there are things in my life that have been affected by the surgery.
Okay, yeah, and we'd like to get you back to some of those things. So what you're going to do is we have some different sizes of paper, and you're going to fill your cup up with things that are part of your life and affect your life. So things that maybe seem like they would take up more space in your cup will be on bigger pieces of paper, and then we have medium and small. And then also things that feel a little bit heavier will be kind of like sediment, and those will be at the bottom. So there's kind of a strategy to how you're filling up your cup. So what I'll have you do is try to think of some things that fill your cup and play a part in your daily life, and I'll have you write those things down, and we can work together to fill your cup up with what you feel like is appropriate for you.
Okay. The first one, the biggest one, one of the sedimentary ones,
Yeah.
is going to be anxiety, because that affects all areas of my life.
Okay.
And I have to deal with that kind of through everything that I had to go through. So that's going to be the first one.
Yeah, and I like that you picked a bigger piece of paper for that one.
Mm-hmm. I also haven't been sleeping well, and sleep is pretty important, so I'll have this one be the middle one.
Yeah.
Sleeping has not been well, so that's going to go in my cup as well.
Great.
I've kind of been relying on my husband to take care of the kids, so luckily he's okay with doing that, so that's maybe a smaller one, but also something that I want to get back to doing. So that's taking care of the kids. And then I also really enjoy spending time with my friends, but sometimes I can't make time to do that because I'm working full-time as an accountant as well. So work is another one that's probably pretty big.
Okay.
Work. And yeah, it looks like my cup might be full, so that's why I don't have much time for my friends.
Yeah, and sometimes we can get to a point where that cup is overflowing, and that might be affecting your pain. So what we can try to do is manage what's in your cup and try to make it so it's not overflowing, so that you don't feel overwhelmed. And part of that might be saying no to things that you normally say yes to, or maybe asking for help. But with using some of these strategies, we can try to make your cup bigger so that you have more space to do more things that you enjoy.
Sounds great.
Great. Okay, so if the cup theory wasn't working for the patient, you could try the spoon theory, because that one's a little bit different. But if you want to take a different approach, you could use one of the 2 videos that we learned about in class for chronic pain, and just trying to get them to better understand the pain that they're experiencing. You could also try mindfulness training. The patient we were working with today experienced a little bit of anxiety, so you could use a breath that maybe helps them feel a little bit more calm. Or you could use like an empowering breath if they're feeling a little bit more fearful.